Good morning, friends. Welcome to our next teaching session. In late 1970s, a doctor from MCD dispensary referred a patient to me for assessment. The patient was a known case of myocardial infarction. I examined the patient and did whatever essential tests were required and took his ECG, which showed inferior myocardial infarction. Then the patient asked me, "Doctor, what about my ischemia of the myocardium?" Well, I told him that it is not possible to tell from this you have myocardial infarction which occur because of ischemia. But whether you have at present ischemia or not, I cannot tell you unless I take an exercise ECG. The treadmill at that time was not available in most centers. Even AIMS did not have a treadmill that time, and they were doing stress testing only on bicycle ergometer. In private practice, I have only means and access to master's two-step test. This test is described in the books on ECG, and the steps are age-wise given in this book. The only change I made was I used to give little more steps than what was mentioned in the book. The idea was only to exercise till the patient develops symptoms, or it is a significantly sufficient exercise, which will be more than normal a person would be doing or exerting in the day. The patient agreed to my suggestion and he came next morning. I gave him master's two-step test and the test turned out to be positive. Friends, this test positive means there were certain signs in ECG which showed ischemia. And what are these signs and their significance? We knew that 40% of patients who have proved ischemic heart disease, they have changes only in the exercise ECG. A small number have changes in the ECG in the post-exercise period. About 8% patients develop changes only during the exercise, and as they finish the exercise, the changes also disappear. 60% of patients who present with symptoms suggestive of ischemia, like angina and others, they have normal resting ECG. Therefore, it becomes important to do the monitoring during the exercise. But since I did not have the means at that time, and in the practice also, other people also did not have these means, therefore I did the master's two-step test. I gave him exercise and took an after exercise ECG. His ECG showed clear cut about more than between 3 to 4 millimeter of horizontal ST segment depression in chest leads. I told the patient that this is clear-cut case of you have clear-cut ischemia and you need to undergo bypass grafting, which was not easily available that time. Friends, what is myocardial ischemia? I have described that there are two main coronary arteries, one on the right side, one on the left side. The left is about 1 centimeter in length, and then it divides into two major arteries, left anterior descending and left circumflex coronary artery. So thus we have three coronary arteries which supply blood to the heart: right coronary artery, left coronary artery, which divides into left anterior descending and circumflex artery. दोस्तों, हार्ट की 3 आर्टरीज होती हैं जो हार्ट को ब्लड सप्लाई करती हैं। उनमें से एक है राइट कॉर्नरी आर्टरी, एक है लेफ्ट जो 2 में डिवाइड हो जाती है और दोनों मेजर कॉर्नरी आर्टरीज होती हैं। एक एंटीरियर डिसेंडिंग कॉर्नरी आर्टरी कहते हैं, दूसरी को सर्कमफ्लेक्स आर्टरी कहते हैं, और ये तीनों आर्टरीज हार्ट को के मसल को ब्लड पहुंचाने का काम करती हैं। ये मैं उस समय की बात बता रहा हूँ जब मिड 70s में हमारे पास ज़्यादा फैसिलिटीज़ नहीं अवेलेबल थी। एक डिस्पेंसरी के डॉक्टर ने मेरे पास एक पेशेंट रेफ़र किया जो मायोकार्डियल इन्फार्क्शन का था, हार्ट अटैक का पेशेंट था, और उसका इलाज मौलाना आज़ाद मेडिकल कॉलेज में चल रहा था, पर वहाँ के डॉक्टर छुट्टी पर थे उस टाइम पर। तो ये इस डॉक्टर ने केस मेरे पास भेज दिया। मैंने उसका ईसीजी किया, उसमें इन्फार्क्शन थी, लेकिन उसने मेरे से पूछा कि क्या उसको इस्कीमिया भी है। तो मैंने कहा कि ये एक्सरसाइज टेस्ट के बाद ही बता सकता हूँ, और उसका एक्सरसाइज टेस्ट मैंने किया जो पॉजिटिव था, जिसमें 3 और 4 मिलीमीटर के बीच में एस्टे सेगमेंट डिप्रेशन था। दोस्तों, एस्टे सेगमेंट डिप्रेशन क्या होता है ये मैं अभी आपको दिखाने वाला हूँ। फ्रेंड्स, सी दिस डायग्राम, व्हाट यू see a normal ECG. What you see is a normal ECG. I am keeping it close to the screen so that at later stage you can stop the video and see the ECG and its finding, so that it becomes clear to you. See, this is the full scale picture, and when I bring it close to, you can see the ST segments, etc., and they are also marked to some extent. The arrow is showing the normal ST segment. Now see this picture, the other one. What has happened in this picture? The patient has been given exercise and the ECG is showing ST segment depression, which is about 2 millimeter in lead V4 and lead V5. It is clear ST segment depression below the baseline. It is 2 millimeter below the baseline. I make it here close to the baseline so that you can stop the video and see the picture here. Now it is quite clear. It is horizontal. You compare the two pictures and you will understand it better. When you compare, you see here what is happening. This ST segment is going upwards, it is coming down and then it is sloping upwards toward the T wave. It is sloping like this. It is going like this. Here also it is going up. It is normal ST segment which slopes upwards towards the T wave. Instead, in this case, what has happened is it has gone downwards, which I have shown in the other diagram. See, from here in this diagram, it is, instead of going up like this, it has first gone horizontally and then gone up. Here also, first it has gone horizontally like this and then it has gone up. It should have gone from here right up like this. It would have gone like this and up, but here it is like this, horizontal. This is depressed, this is abnormal. This shows that the myocardium is not getting sufficient blood. So friends, the advice was given to him and he felt satisfied with that advice and went back to his doctor. So friends, these are the type of things which come. A friend of mine came and asked me what is the need of doctors, and I really wondered to what answer should I give him. This I am sure this case clarifies what is the need of the doctors, because this type of skill the patients cannot develop in them. Just of course they can understand it, but they cannot decide, they cannot take decisions themselves. Yes, this is sufficient to guide them that they should go to a suitable specialist and get proper treatment. So friends, next time we will meet with another interesting case. Thank you very much for listening to me.